With a relentless focus on excellence in healthcare, Pullman Regional Hospital presents the Health Podcast.
These days, people have personal chefs, personal masseuses, and personal shoppers. But what about a personal orthopedic care coordinator who's with you every step of the way as you recover? To talk about personalized orthopedic care coordination, today we're joined by Miley Keller, PTA, and the orthopedic care coordinator at Pullman Regional Hospital. Miley, welcome. What service are you providing to joint replacement patients?
I'm providing patients who are considering a total joint replacement or those already scheduled for surgery the opportunity to meet with me individually prior to surgery. Prior to COVID-19, Pullman Regional Hospital offered a total joint replacement class each month that I would lead and go through some of the same things that I do now. I am now available twice a week to patients instead of just once a month. My role as the orthopedic care coordinator is to help guide the patient and their family or support person through the total joint process.
Great. And what are the benefits of this service, and do you think it leads to better outcomes?
It really allows the patient and family to learn how to prepare for the total joint surgery and what to expect during their hospital stay and for the weeks and months to follow. I take the patient step by step and kind of outline for them what is involved in the process. We discuss what needs to be done prior to surgery, things like having medical clearance from their primary care doctor and dentist, maybe going to pre-physical therapy, setting up transportation, home safety and equipment needs, and discharge planning. Also, if something stands out or there is a concern, I'm able to communicate that to the orthopedic surgeon before surgery. At Pullman Regional Hospital, we have an orthopedic care team that includes nursing, occupational and physical therapy, social services, hospitalist doctors, pharmacy, anesthesia providers, respiratory therapy, dietitians, and a representative from insurance and billing. If a patient has specific questions or concerns in a particular area, I'm able to connect the patient with the right team member. And I go over what the patient can expect during their hospital stay, what goals the surgeon likes the patient to achieve prior to discharge, pain management, infection prevention, and help them plan for a safe discharge and successful outcome. And we believe it does lead to better outcomes. When a patient understands what is involved in the total joint surgery and is prepared prior to surgery, it allows them to be confident and successful. The patient surgeon, myself, and the orthopedic care team are all here to help the patient understand and navigate the total joint process.
That is a whole lot, and it sounds like a very big job you have, Miley. What are some of the most common questions you get asked?
Should I be doing exercises before surgery? How long will I stay in the hospital? When will I start outpatient physical therapy? What kind of equipment will I need? How much pain will I have? Do I need help when I get home? And one of the most common questions is, when can I drive? Or when can I return to work?
And you have all those answers. I'm sure it's different for each patient,
Yes.
More of an individual thing, but at least they know who they can go to ask these questions, right?
Yes, absolutely.
Does every joint replacement patient get a personalized appointment with you, Miley?
They do. I am available on Tuesdays and Thursdays in person, by phone, or by Zoom.
Oh, that's great. So all they have to do is sit on their couch and, get started with the whole process. Are you the point person, the first person they talk to?
It depends. Sometimes I am, and other times they've already met with the surgeon at Inland Orthopedics.
And what other departments do you relate to and liaise with?
With our nursing staff here on the medical surgical floor, occupational therapy, speech therapy, our social services team, nutrition, pharmacy. We're all part of the orthopedic care team.
That is awesome. So you're not operating in silos. You're all working together for the patient's health.
Yes, absolutely.
Oh, that is wonderful. Is there anything else you want people to know about you or the services you're offering?
Anyone can access the total joint replacement class that we have online also. It can be found on the Pullman Regional Hospital website.
And tell us a success story of a patient you've worked with recently.
With COVID-19, we used to have here at Pullman Regional Hospital a very open visitor policy, and it gave us a chance as the team to help provide education and prepare family members prior to going home. And with COVID, we had to modify our visitor policy. We've had several patients who, after collaborating with nursing and physical therapy and occupational therapy, we needed the family member to be there for training and to help the patient through certain situations. And we were able to contact the surgeon and our hospital team and allow that to happen. And it really brought closure before we sent that patient home. And so we could feel good that the patient was going to be safe and successful at home after leaving the hospital.
That is wonderful. It sounds like you love what you do, Miley.
I absolutely do. It's been 25 years that I've been a PTA, and I've been here at Pullman Regional Hospital for 15 of those years.
Wow. Well, for you and everyone at Pullman, we appreciate your time today and for everything you do for the patients. Thank you so much for being with us today.
Thank you so much for having me.
Learn more about this subject, providers, and services at Pullman Regional Hospital online at pullmanregional.org/joint replacement. This has been the Health Podcast from Pullman Regional. I'm your host, Deborah Howell. Thanks for listening and have yourself a terrific day.